Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the brokerage for 15 years. So today's topic is two completely different practices. One only grosses $550. The other grosses $2.7 million in the same town. Why the difference? So we could talk to you about that and give you all the information. Now, before we get into that, as you know, it's really sunny out here in Jersey. Just got back from Utah. Whew. As you know, we're working 363 days a year. We take off Christmas and Easter, and here to serve you. You can reach us at 201-663-0935, or you can get us at nationwidedentalpracticebrokers.com, dentalpracticeguide.com, always available to you. Now, continuing, if you have one of the large practices, that's a DSO, probably looking for, that is over $1 million and has a nice size staff with hygiene department and willing to work 3 to 5 days. A lot of opportunities for you there if you go for the large DSOs. And we do sell to them, but we're independent of them. But some of my doctors have sold to them and been very happy. And we have been working with them for a period of time, independently, of course. We know the best ones are. I've been shifting to the larger DSOs lately. A little bit away from the smaller ones, but it always depends on the circumstances. I think you'd have, if your practice is over $1 million, you have 5 operatories, willing to stay on 3 to 5 years, have a good solid staff, hygiene program, you could be a good candidate for them. We know what the best ones are. They will often pay our commission. So generally there's no commission for you, so that works out real nice. In addition, if your practice is, we're representing you, you're over $1 million, we will often reimburse your legal fees. In other words, it's private or a DSO sale, doesn't matter. You're over $1 million, generally, based on certain criteria, we will reimburse your legal fees. I think we're the only ones doing that. We've done that several times. So let's get back to these two practices. What's going on? How could you have one guy doing $2.75 million, not really accepting insurances? And if he does, it's more of a, we'll send the insurance for you, pay us up front. So really doesn't have accounts receivable. How could you have one guy, one gal, doing $2.7 million? And mostly all fee for service. And you have somebody else that's only grossing about $550 and kind of struggling a little bit. How can you have such a huge difference? How could that be? We went to visit both practices. One practice, the guy or the gal never advertises. They said, yeah, they did in the beginning, but they just do internal advertising, community relations, community affairs, sponsor the baseball team, that type of thing, get involved in the community. And the one 2.75 says, well, just, we open the doors and we take care of the patients and we do great work. We do a lot of big cases and it's just word of mouth. I guess perhaps it's excellence in dentistry, perhaps the location. They are located close to a major, shopping center with good visibility, although they're on more of a secondary road, had a very big sign, but no active marketing now. They did active marketing a while ago. I'm not even sure if they have a website, come to think of it. So, excuse me, it's that Utah air, it drives me out. How can this difference be? Then when I speak to the other doctor doing about $550, he says, oh, they don't want to go for extra procedures in this town. And I'm thinking, you're only 2 miles away from the other guy. How could that be? They don't want to go for the procedures. They're a little tight. This is more of a blue-collar town. And I'm thinking to myself, well, the other guy's doing $2.75 million, doing big cases. How is it? How could that be? I would say it comes down to your staffing, your location, your presentation, your clinical skills, your staff. I mean, that's the difference I could see. The 2.75 had a really motivated, dedicated staff, great communicators, and I didn't see it with this one fellow. So there's something going on there. Something is going on. And he's missing it. I think you'd have to do an in-depth analysis of the $500,000 practice to see what his case presentations are like. What is his staff like? What's the phone etiquette like? That's where you start off. Then you go back to study the other guy, and what is his staff? What's his case presentation? Is he afraid to present big cases? Who's doing the presentation? Are they presenting all the financial options? You got to get into that. So there's a big difference there, and you could do this. You could make that difference yourself. You study these practices. Once again, presentation, communication, financing, case presentation, having the patient comfortable, making the patient happy. Have your dental office a place that people want to return to. There's something missing with this other office that's only grossing, $500,000 compared to the 2.75. It could be personality. It could be so many different things. But one of the issues for sure is the gross income is dramatically different in two different towns. And when the one doctor said to me, these patients don't go for big cases, I'm saying to myself, well, the other guy's doing really well. What is he doing that you're not? Are you afraid to present the cases? How are your cases presented? Are you giving financing? Something is missing. So something to think about, okay? All right, team, got to run. Remember to sign up with our on the YouTube to get this, and send in your NDA to us if you haven't, so you get all the work, all the practices updated. Thank you so much. Bye now.